Flu season is once again upon us, and you may already know that if you have children at home. However, December to March is historically the worst of flu season. Experts say the change in weather, as well as those get-togethers indoors, are why we see diseases spike from December through January. But there are things you can do to decrease your chances of getting sick. Here to help is Dr. Marni Shoemaker, Division Chief of Infectious Diseases at the University of Kansas Health System. Doctor, thank you so much for being here. We appreciate your time this morning. And, you know, for all of us who don't want to skip out on all of that holiday fun, what are the best ways to avoid illness while attending these gatherings?
Yeah, I think you touched on it. I mean, the single best way to avoid these infections is to avoid people, but most of us like to get together with our family and friends. As far as influenza, we talk about the flu season. The single biggest way that you can protect yourself from influenza is to get the influenza vaccinations. Additionally, there's updated COVID vaccinations this year. And then for people of a certain age, they can get the RSV vaccine. In addition to the vaccines, one of the single biggest things is cough etiquette. Elmo said, always cough into your elbow, as well as washing your hands. And if you're sick, particularly if you're sick with a fever, stay home. If you're sick with the sniffles but not a fever and you're going to be around people, pay particular attention to the infants and the elderly or anybody with an underlying medical condition that would weaken their immune system.
Yeah, and I think it's all great that we get a refresher on the cough etiquette, too, myself included. Would you mind outlining the differences as well between these common types of winter illnesses? It's easy to self-diagnose, but what are the differences between RSV, the flu, and COVID? So influenza is a systemic illness we typically think about, lay people may think about it as a lung infection, but it's really a systemic illness where you have high fevers. Adults will have fevers up to 104. They will have severe body aches and shaking chills. People can sometimes remember exactly when they started to come down with it, and it's described as being hit by a bus. RSV is something that we have historically seen in children in January, February, March. We're seeing it more and more in adults. I think some of that has to do with improved testing capability. RSV is a lung infection. It can cause wheezing, cough, and shortness of breath. And COVID can do pretty much anything at once. It's particularly a respiratory illness, but it can also cause GI illness, diarrhea in about 20% of folks. We have about a minute left, but I wanted to ask you, how has this flu season been compared with years past?
Well, I will say since COVID, the flu seasons have been a little bit erratic and unpredictable. But this flu season, we have seen, at least locally, an uptick in influenza A over the past couple weeks. So it feels like it's on a trajectory to be a flu season like that which we had before COVID.
And
but only time will tell with that.
It certainly will. If you do get sick, what are the best ways to get well fast?
So if you do get sick, see your healthcare provider and get diagnosed. If you have influenza or COVID, we do have antiviral medications for that that can treat it. So I would recommend getting in to get diagnosed so you can get treated, and so that you can properly protect those around you by knowing when to isolate and stay away from family gatherings.
All right. Dr. Shoemaker, thank you so much for being here.
Thank you for watching. Go to NewsNationNow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.